EONS has its own track as one part of the sort of multi-professional team of oncology, and nurses provide a very important part to the support of patients. What EONS stands for, I think a lot of people don't understand what nurses do in oncology. But if you look at EONS as a group, we represent the national societies across Europe of nurses who are working in cancer care, which is roughly about 22,000 members, which is a substantive number of nurses.
Yeah.
And what we try and do in this meeting is to identify the science and the evidence base for providing nursing care, and also looking at the research that identifies how nurses can reduce symptoms, that be a very important part in improving patient outcomes, but also how we organise services appropriately so that patients have the right care at the right time in the right place. Well, I think a meeting like this focuses on the science. It's focusing on the development of the biosciences, the basic clinical science, and we talk about bench to bedside. And nurses are often forgotten in that whole transition in terms of the care management and the research that's required to actually provide medications in the right way and also to provide schedules that are optimal. A good example I always give to people is that we talk about the science, a bit like the scaffolding of a stand, and it's very strong. We have very clear mechanisms of researching these. But people are inevitably complex, and we're talking about complex healthcare issues in terms of social care, an ageing population, all these issues. And so it's a bit like having the scaffolding standing on a very wobbly chair, and nursing provides a lot of support for that chair so it doesn't slip, that people take their medications, that they are adherent to therapeutic regimes. And that support can be psychosocial, it could be through symptom management. And there's a lot of good research evidence from the US and Canada that would suggest that if you have well-trained oncology nurses, that you can improve outcomes for patients. So I think in terms of the research and how nurses fit into a very science-based meeting like this, that we are very important in terms of improving some of the outcomes for patients in a broader context than just the basic science. Nursing is very different across Europe, and I think one of the issues is about the sort of creativity that is required to manage the sort of changing demographics that we're going to have in the future, that we've got to look at different healthcare delivery techniques. And you need well-skilled people to do that. Now, across Europe, the nurses have very different roles. I come from the UK. Nurses can prescribe in the UK. We have limited prescribing ability. A lot of specialist nursing, and the same across, say, Scandinavia, where there's a lot of specialist nursing. About 13 countries in Europe have specialist nursing roles, but if you're talking about the breadth of Europe, a lot of nurses are not expected to do continuing professional development. Cancer as a speciality sort of is not recognised, and oncology nurses in many countries are working in general settings. So that means that there isn't the sort of development of the skill sets and capacity that we will need to deliver very intensive therapies that are have very acute symptoms and issues. And also in another form, in a lot of the care is being now provided in the community. So we've got almost two opposing areas of cancer care. We've got the community area and the very acute, and you need different skills in those different areas. And this is why EONS is developing these curricula that help develop key skill sets that are required for, say, for example, breast care nurses across Europe, lung cancer nurses and people working in older care. And we have a post-basic curriculum that gives a core standard of what oncology nurses should be trained in at a basic level for their provision of cancer treatment. We offer translation grants. So a society can come to us and say, we'd like to translate this, and we provide the support and the translation costs. What we are finding is that 5-6 years ago, nurses were unable to speak English, unable to access the evidence. And you can see from this meeting that nurses are being skilled up to graduate level now, have a much better understanding of English. And although we offer in our meetings, we offer German translation, we are moving towards more and more nurses actually being able to read the evidence in English, provide evidence in their own language, and develop capacity in that way. You'll notice there's very few German nurses here. And it's partly that that in Germany nurses are really not seen as having a speciality role and not a professional in their own right. And I think this is sort of indicative of this belief that a nurse is part of the hospital and would provide care as part of the service. But when we talk about, quality healthcare outcomes, you've got to talk about all professional groups, not just the disciplines that are medical. And in Germany, there are a lot of junior doctors. There isn't such a nursing role in specialist care. And for many German nurses, the English is not a first language, a language that they're good at. So we provide German translation. But I think there is a big move to actually make nurses in Germany not a key component of healthcare. And I think the ambulatory care policy is an indicator of that. I think that is a sad reflection, but in many countries nurses are growing in strength, and I think it's about the multi-professional working. It's working in partnership with patient groups that voice their support of nursing as a key requirement. And I think we're as much to blame in that we haven't developed the evidence base for what oncology nurses do, and also what oncology nurses can contribute to healthcare.